According to the latest figures that we have, it does seem that the fourth wave is gradually coming down in intensity. At the present time, all we can say based on global information, global data, past experience of epidemics, how this virus has behaved so far, is that it is possible that there may be additional rises in the number of cases in the coming months. But this is all conjecture. Having responded to COVID, the system's strengths have become visible. For example, the whole testing regime for COVID were coming through on the polio dashboard. So we were able to leverage and utilize what existed, but also strengthen the other side. For example, in polio, for now 8 months, we have not had a single case. And so today, as far as polio is concerned, we stand in the best possible situation that we have had ever. And we want to leverage it to a complete eradication, the need for a vaccination. And I think this is what we are trying to do as part of our obligatory regime. We already have restrictions in place, and some of which are being gradually eased. And I think the easing of these restrictions could be tied in to the proportion of a city or a zone that is vaccinated to prevent unnecessary and painful restrictions. So over 75 million individual doses have been given. If you count the eligible population, which we count as those over the age of 15, those are about 16 or 17% of the population has been fully vaccinated. By the end of the year, we should have the large majority of urban centers, the 20 or 25 major cities nearly completely covered. That would protect us from sparking of the epidemic. And by the end of the year, we do feel that anywhere between 70 to 100 million population ought to have been vaccinated. All of us is interested in making this risk go down to nearly zero. And the only way to do it is by doing reliable tests at departure. It'll never be 100% because tests are not perfect. You will miss an occasional test here and there. We've had very direct engagement with the UAE as well on this matter, and a very frank and open discussion and a very healthy discussion, and we put forth our suggestions and thoughts, and we heard from their end as well. In all these situations, when a traveler boards and they arrive, sometimes there is disconcordance. We've seen the reverse as well, and we've seen the reverse coming from many of the same countries. The bond between Pakistan and all the Gulf countries, between Saudi Arabia, United Arab Emirates, Bahrain, Qatar, Kuwait, Oman, all of these are brotherly countries and old friends, and these friendships run very deep. There is a lot of respect and regard for Pakistani health professionals in all these countries. The most important bit is that the trust on our health professionals certainly exists, and I think that you will see that you will continue to find this old tradition of our health workers helping out in the Gulf countries.